Hi, I'm Brian McCrindle from the Hospital for Sick Children in Toronto.
And I'm Ann Rowley from Northwestern University in Chicago.
Yeah, and we are the co-chairs of the 11th International Kawasaki Disease Symposium here in Honolulu today. We'd just like to go over some of the items that are going to be coming up on the program today. This morning we're going to be starting with our opening sessions where Elliot Antman, the president of the American Heart Association, will give an address. Then we'll also have Greg Chin from the Kawasaki Disease Foundation say a few words together with greetings from Dr. Kawasaki is here. And then Ann and I will go over some of the abstract submissions, the content of the program, the history of the program. After that, we will have the Yuki Lin Takahashi Memorial Lecture, which will be given by Professor Nakamura from Japan about the lessons from the various epidemiologic surveys they have done in Japan. And then the rest of the morning and the lunch symposium will be dedicated to looking to various epidemiologic aspects of Kawasaki disease. We have a large number of countries that have submitted data to this meeting, including some new countries that we haven't seen before, such as Algeria and Argentina. We'll be hearing about some of the methodologic issues around doing epidemiologic studies, such as using nationwide surveys, such as they do in Japan and Korea, or using administrative data, which is increasingly being used in Canada and the United States as surveillance for Kawasaki disease. Some studies will only include single institution data, such as China and Boston, and some studies actually incorporate data from across multiple countries, such as from Latin America. The epidemiology and clinical characteristics from special populations will also be described, and variations in clinical aspects such as resistance to initial therapy, shock syndrome, rashless Kawasaki disease. Probably one of the highlights of the epidemiology has been we've had a large number of submissions that are specifically around the environmental epidemiology, which at the last meeting was a hot topic. Things like wind patterns outside of Japan, the role of concurrent infections or an infectious trigger in the etiology, the role of elevated environmental allergens or pollutants, and issues around the seasonality of Kawasaki disease. So the epidemiology sessions are going to be new and cutting edge.
Very good, yes. And then we're going to move into some discussion of the genetics of Kawasaki disease. So we have lots of evidence that indicates that there are genetic factors that predispose to Kawasaki disease, and yet, although we have identified a number of genes where clearly the presence of that polymorphism increases the risk of Kawasaki disease or the risk of coronary artery disease, still, if you put all those genes together, it still does not explain Asian predisposition, the higher attack rate in Japanese and Korean and Chinese children. So we realize that we have a long way to go as far as really understanding what the genetic factors are that are important in Kawasaki disease. So we have a panel of experts who are going to be hopefully discussing all of this together and giving us some ideas about what they think are the most appropriate directions to go to move that work forward and make some real progress in understanding what those genetic predispositions are. We have some specific abstract presentations on some studies that have been done more recently that may shed some additional light on these genetic factors, and those will be of great interest. We do have some presentations on the pathology of Kawasaki disease, which we still need more information to understand the pathologic changes that occur over the course of time in the coronary arteries that are affected by Kawasaki disease. So we're going to learn more about that at this meeting because that has big implications for what happens to the patients who develop coronary artery disease. And then we're going to learn some more immunology about Kawasaki disease. This is one area that sometimes provides clues to etiology and also provides clues to what might be the best therapies for Kawasaki disease. So the immunology is very important. We're also going to move on to an etiology and pathophysiology session. And of course, as Dr. Kawasaki mentioned when we talked with him yesterday, the most important mission of Kawasaki research really is to identify the etiology. And this has been a very difficult problem to solve. As Dr. Antman mentioned, there are new techniques that are emerging that can be applied to the study of Kawasaki disease. So we're going to have a presentation on use of high-throughput sequencing in Kawasaki disease tissues. And we're going to learn about all the difficulties in identifying potential new infectious agents using that methodology, but also the promise of that methodology for the future. And then we'll have a number of presentations that will discuss more about the pathophysiology of the disease. Again, these would be more molecular-based studies that might help us understand more about gene and protein regulation in Kawasaki disease, and again, potentially lead to therapeutic targets.
So you were right in mentioning that Dr. Kawasaki yesterday said the number one priority for him is to know the etiology, because that's the only way we'll be able to target specific therapies and have a chance of someday preventing this disease. Do you think we might hear that today?
The definite etiology? I don't think today, but who knows?
I think we'll have a lot more cues.
A lot more
clues about it.
A lot more clues. Yes, I think that would be very useful.
Okay, thank you.